With class back in session, some schools around the country are implementing changes to address students' emotional and mental health. A new pilot program aims to provide tailored support to nearly 500 schools nationwide. As ABC's Rena Roy reports, advocates say this is a growing need in schools.
There have been some improvements in teenage mental health over the last few years, but overall, it's still a pretty dire situation.
The JED Foundation and AASA, the School Superintendents Association, launched a new pilot program, the District Comprehensive Approach, or DCA, in 480 schools across 14 states to address student mental health.
In our training, we talk about mental health services, but it's not necessarily been on the menu.
The DCA focuses on assessing the mental health needs of students, analyzing where the gaps are, and using that data to create a strategic plan of action that meets the unique needs of that district.
A lot of district leaders know that they have mental health needs for their students that they need to attend to. They just don't know how to give it form and shape and life and what it should look like.
In rural South Carolina, Lawrence County School District Superintendent Dr. Jody Penland is excited about the DCA program, saying student mental health is a real problem in schools.
Kids can't grow, kids can't learn, kids can't succeed if they're struggling.
Lawrence County High School senior Balin Harlan says juggling classes and extracurriculars can be stressful for him and his peers, plus the pressure to fit in.
Everybody wants to be known by everybody. And so trying to juggle that and trying to live that social life and how people view them on social media and in person has just brought a great deal of stress on students.
He says the school's efforts are appreciated by students.
No matter what is going on in a student's life, we don't want to see each other fall. So we all try to be there for each other. We see our school adding more stuff for us and trying to help us mentally and create that environment even more, so that it's not just on the students.
So what do these changes look like? In some schools, it's adjusting student schedules,
Where there are more opportunities for brain breaks, for just an opportunity to maybe practice yoga.
or creating a plan for when teachers notice a student is struggling.
If every school would implement these types of changes, our future will be young adults that will be true citizens, run our country, run our businesses, and kind to everybody.
The main goals for the program: protect youth mental health and prevent suicide, the second leading cause of death among young people ages 10 through 34, according to the CDC.
The what ifs we would have done is not a question you ever want to have in your life. I'm so happy that JED and AASA has provided this opportunity to help us look at the beginning of the mental health of our kids to see what we should be doing instead of what we should have done.
Rena Roy, ABC News, New York.
The DCA program has recruitment in progress for up to 30 more school districts to take part. You can find out more on jedfoundation.org.